Now, the other thing is that the T1 half of astaxanthin, so here's some numbers. It's very safe. You can take very high doses. In some clinical trials, they took up to 100 milligrams of astaxanthin 3 days in a row. And you don't turn orange. It takes about a month for you to turn orange if you did that every day, which is really not a very good idea. But it's very safe from a tox point of view, okay? However, if you look at this, T1 half, what is T1 half? T1 half is the amount of time for half the astaxanthin in your serum, not your flesh, to decrease by 50%. So 16 hours it takes for half of it to disappear. Well, if you take another tablet at the end of 24 hours, guess what? It starts accumulating even in your blood, okay? So taking 12 milligrams a day is really not too smart, okay? And I think it's irresponsible to be offering those levels of dosing. Anything more than 4 milligrams is financially a waste. It's not a smart idea. It's not a good idea. It adds no health benefits. Now, the other thing is that at 8 weeks, at 6 milligrams a day, there were no negative health effects. But we're not looking for negative health effects. We're looking for positive health effects. And the way to get that is at 2 milligrams or 4 milligrams using a highly absorbed formula. And that highly absorbed formula, if you're a vegetarian, should be perilla or chia oil, along with the surfactant. If you're not a vegetarian and you want to get a super absorption, take it with a krill oil tablet, because krill oil is an excellent dispersant and absorbing aid for astaxanthin, supplemental astaxanthin beyond what's normally in krill. Now, is astaxanthin in serum a good biomarker for astaxanthin absorption? And the answer is not really, because astaxanthin, what happens when it's blood? Well, it does dissolve in LDLs and it helps prevent plaque formation. However, its main job is to go to your membranes. Its main job is to go into your connective tissue. Its main job is to go into your flesh. That's the place it does the anti-inflammatory work, protecting DHA from being oxidized, keeps your membranes from turning into leather, and that sort of thing. Our formula has over a 100-to-1 oil to astaxanthin ratio that's highly absorbed. And again, the other trick is to use krill oil. And our recommendation on krill oil is 300 to 600 milligrams a day, no more than 1 gram a day. We think that those are very effective levels. Now, here's a chart of astaxanthin absorption after a dose of about 40 milligrams. And this is just to show that after 8 hours, all of it is definitely in the serum, and it stays in serum up to 100 hours. And while it's declining, it's going into flesh, it's going into membranes, it's going into your fat. Our formula is this formula here. This formula is a synthetic soap-containing formula, which I don't recommend for human consumption. This work was done in Sweden by Odeberg and also a co-worker of Fuji, and a very fine piece of work. Now, here are the facts in flesh. Now, we couldn't take any humans and cut off their pinkies and see how much astaxanthin they have in their flesh. So we've taken another animal. I'll tell you in a minute what it is. But this slide clearly shows that astaxanthin over the weight of the animal, as the animal gains weight, actually increases. And in this chart, we're talking about a trout, okay? And this is the control group, and this clearly shows that astaxanthin bioaccumulates. And that's good, but not truckloads of astaxanthin. That's not good, that's not smart, it's not economic. Don't recommend it if you own a store or something like that. Now, astaxanthin must be dispersed. I've talked about this a couple of times. It needs to first be hydrolyzed in your gut. Unlike lycopene, can be directly absorbed. Astaxanthin needs to be free astaxanthin before it's absorbed. Even if you're taking krill oil, it needs to be liberated from the krill oil before it can be absorbed. And if you have an oil around, that's a great way to get it in. Now, the other thing is that science has shown that astaxanthin at a high dose is relatively less absorbed than at a low dose. And again, that's very easy to explain with the physics and the chemistry of dispersion in the gut. Taking a big slug of something, generally that big slug just keeps moving south instead of having time to be absorbed. So it's much more wasteful to take a large dose of astaxanthin than a reasonable dose of 1 to 4 milligrams. If you look at blood vessels, this is how plaque forms. LDL is selectively deposited in a blood vessel, and it's oxidized. It turns to leather. It turns to plaques, okay? Astaxanthin, and to some extent, other carotenoids. But remember, astaxanthin is the most powerful carotenoid, the most powerful in the oil world. It can't be compared to vitamin C. But it keeps this stuff from hardening, and over time, there's going to be less plaque formation. That's a fact. Now, is that a disease? Yeah. No, it isn't a disease. What is a disease is what you get from if these plaques block your arteries. Then you have heart disease, and then you have a heart attack or something like that. So your lifestyle, keeping that blood moving, the things you eat, the fats you eat, the carotenoids you eat, and the king of carotenoids, and preventing peroxidation of lipids is astaxanthin. And that's what I'm trying to show on the slide. Here's just a close-up of one of these ugly plaque formation situation. It can also, as you can see, rupture the wall of a blood vessel. And by having antioxidants here, it can keep this soft and pliable and not hard and susceptible to, like a knot on a tree, just ripping apart the tissue that is trying to transport life-giving blood. This is just a schematic of what a membrane looks like, and it's important to note that this layer here is the water-loving layer, the hydrophilic layer. The tails of the fatty acids are the fat-loving, so that's in the middle of a cell membrane, and the astaxanthin intercalates or inserts or goes into, resides in this membrane right here in the middle, and it stands head to toe. Okay, so it lines up with that DHA, keeps that DHA being oxidized. Now, why is that important? Your brain is 35% DHA. Your eyes are 30% DHA. Your cell walls are 30% DHA. When that oxidizes, they turn to shoe leather. All right? DHA turns over real slow in the body. If you don't take your fish oil or your krill oil one day, you can still take it the next day, you'll still get the benefit. I suggest taking krill oil every day. But the point is, the turnover of DHA in your body is about 45 days. That's why krill oil, even at its low concentration of DHA, but in the bioavailable form of phospholipid, is a great way to replace the DHA in these membranes, and then the astaxanthin protects it from oxidizing. So Mother Nature can do the turnover without having something that is oxidized and then it's going nowhere.